Now concussion is essentially a blow to the head or to the body that's transmitted to the head that causes a change in brain physiology, which means they might be dazed, confused slightly, or it might be more significant in which they had some kind of symptoms, visual or otherwise, that is associated. And then there are events that occur afterward, symptoms such as headache, cognitive change, irritability, psychiatric abnormalities and such, which occur. The problem is it's a very broad spectrum that defines a concussion, and in many ways it's only as good as the individual's ability to report accurately the symptoms. So what happens in essentially a blow to the head with or without a helmet
flat out ball, and there is the biggest hit maybe
is the transfer of kinetic energy to the brain and rotational forces that cause shearing, ultimately disruption of brain connection fibers. It used to be thought that concussive injuries virtually always got better within 3 or 4 days. Careful epidemiological studies have shown that that's not the case. Even in young high school athletes, for example, or college athletes, more than well over 50% of the individuals have significant symptoms more than 1 week after injury, generally more than 10% at more than 1 month after injury. Although there's been a lot of hype about advances in helmet design over the last 10 or 15 years, there's little evidence that those helmets are significantly more protective for concussions than much older helmets. Indeed, there was a study that staggered many in the community that appeared in the Journal of Neurosurgery in 2012, in which they looked at essentially helmet-to-helmet hits, where the initiating helmet was a contemporary lightweight football helmet, and the receiving helmets were 11 different modern designs of helmets versus 2 old leather helmets circa 1900. And in a great surprise to the investigators, in many cases, in fact in most cases, there was little benefit to the advanced, more modern designs as compared to leather helmets. And in some cases, the leather helmets appeared superior for certain kinds of hits. Most of these injuries occur in practice, not on the field, which are even less regulated. So I think parents increasingly, and coaches who are getting this, are recognizing that limiting contact in practice is pretty important for the young brain. The other is probably more attention to rule changes that really prevent the kinds of helmet-to-helmet hits that can cause particularly severe damage. And lastly, I think a push in 2 regards. One, to be much more conservative in terms of return to play rules that should require more testing, not less testing, to get back into the game, and then more research that's relevant to the issue of football-type concussions, and trying to create essentially a platform for evaluating what happens during those hits and preventing the consequences of those hits.